Hello and welcome to today's webinar, Digitally Integrate Behavioral Health to Elevate Experience and Streamline Navigation. We're very fortunate to have with us today Clay Nichols, Chief Commercial Officer at Credible Mind, Aaron Kessinger, Principal at Michael Best Strategies, and Dr. Jennifer Christian Herman, Vice President of Clinical Strategy and Programs at Blue Shield of California. Before we turn the program over to our speakers, I will go through 3 poll questions. All right, poll question number 1. Do you proactively screen members for behavioral health challenges today? Our second poll question,
what behavioral health specific care navigational support do you offer?
And for our final poll question, where is your organization in integrating behavioral health into a whole person model? And now I'd like to turn the program over to our speakers. Go ahead, Aaron.
Good morning, everyone. Thank you for joining us today. I've been asked to share some perspectives from payers because we as Strategies talked about 75 payers over the course of the year, all the nationals and regional players as well. So we get a perspective on what they're thinking from a mental health perspective. So I'm just going to share a few slides with you. First of all, the expanding landscape. I remember back in 2009 when I was in the Humana Tower and we were working 12 and 13-hour days trying to figure out how to operationally and financially integrate mental health from a parity perspective. And just this past fall in 2023, a lot of questions that were still unanswered from that initial legislation finally got answered. And another interesting point too, I didn't know this before coming in today's call, but one of our research analysts told me that Medicaid is the single largest payer of mental health services, and probably not surprising given the challenges that population has. The other thing I remember is back in 2009, it wasn't widely understood that mental health had a direct impact on physical health. And I think we all agree now that over the course of time and up into including today, that this is now a very solid stance, that people understand that there's a direct correlation between the two. And payers are covering a wider array of solutions to try to meet these needs because a lot of responsibility is placed on you and providers to work together to figure this out through value-based care, integrating mental health with the PCP setting. And I thought it was interesting, one of the survey questions that we saw earlier, 50% of you indicated that you rely on those network providers and primary care physicians to do that assessment. But also just you're embracing more telehealth solutions. And it was also interesting in the questions that we did up front that no one is right now using AI, but there's definitely indicators that we're going to have to use AI in the future to meet these needs. So what are the challenges that you all have? These are probably not new to you, but we just wanted to level set today that the provider shortage always comes top of mind. We've been doing some surveys, and we'll talk about a survey that we're currently doing as well. We'd love for you to participate in. That this is one of the major problems. And the things listed here, most of the people in the US live in rural areas where they don't have access to mental health providers. COVID exacerbated this, and of course the lower reimbursement rates for mental health compared to physical health reimbursements is much lower. The other thing too is navigation. So how do you find the resources that you all work so hard to make available to your members? How do they find those? And it's challenging. Members struggle with where to go. They don't know how to start. They often are not aware that you've made self-assessment tools available to them to help them understand that. So the other thing too is that primary care physicians try to do this, but they're not overtly aware of the solutions that payers make available to members. And then engagement, this is not a challenge that's just for mental health. This is across any solution that you roll out. Engagement's always a challenge. But it's exacerbated a little bit by the stigma, application fatigue. Do they even have access? Can they get to a mental health provider? Is it too far away, or do they have the digital capabilities to use one of the solutions that you've made available to them? And we're hoping that the new coaching, Medicare just recently is going to reimburse for coaching. There's still a lot of open questions with that too, but we're hoping that virtual coaching will help this as well. And then finally, at a payer, from my perspective, spending 25 years at Humana and United Health Group, it's always important to be able to measure the impact of what you're investing in. So this is always a challenge. There's new regulations coming out, especially around screenings and how we can do screenings. This is not in the slide deck today, but also would want to mention too that we're seeing a lot of voice biomarker technology come out that will increase that ability to do more screenings for payers. So a lot of challenges, but there's things that you all are working on that we're hearing from other payers, that you're embracing telehealth and digital mental health tools. You're looking at data and outcomes, especially from a value-based contracting perspective. Providers are struggling with sending members to the right place and finding the right care, but they're increasingly being put online to provide more services around that. And integration with primary care, looking at the whole person, this kind of gets back to the correlation between physical and mental health. And then finally, prevention and early intervention. So finding the right solutions for them, making sure it's easy for them to navigate, and looking at additional resources such as coaching that will close the gap. So I mentioned earlier that we've been, and we're still currently doing a survey with payers. I'm going to show you some results on the next slide, but this represents about 50% of the population in the US of the payers that we've had respond to this survey initially. So we'll make sure that you have access to take that survey, but these are the results. Most say that mental health is a top 3 priority, and not surprising given the new regulations, the realization that there's a direct correlation between medical spend as well. The top gaps, no surprise here, network size, one-on-one coaching is expanding, but it's still not extremely prevalent in the offerings. And the integration with physical health. 2 and 3, screen members proactively to support navigation, and greater than 50% are considering working on a whole person care model, not looking at just the medical claims, but also looking at how you can tie in the screenings for mental health along with those medical claims to understand how to help that person overall moving forward. So if you'd like to participate in the study and receive the results, just let us know. You can do that in the chat. And I think there's also going to be an opportunity at the end for you all to find that survey as well. With that, I'm going to turn it over to Clay.
Thank you, Aaron. I'm Clay Nicholas, Chief Commercial Officer for Credible Mind. Really appreciate everyone taking the time today to hear and learn more about this integration of behavioral health and navigation and how we're helping to support our customers and members in that process. At Credible Mind, we're a digital mental health platform that's really focused on helping to improve access to behavioral health care services, drive better care navigation, and support our members and our customers in better outcomes. When you look at the market, one of the things that we've seen in our research and really helped drive the emphasis around starting this business is that the mental health market today is really underserving most of the population that needs help. So I think we need to face an uncomfortable truth that the way the model has been working has been very reactive, waiting for people to need care and showing up to care when they're at their most high level of need, but not being proactive in addressing the needs early on. And what the research shows is that 75% of people feel like they have a mental health issue or concern. They actually prefer to start on their own with some type of health, self-help, or self-care resource. And that could be using an app to learn how to meditate, learning how to sleep better, or taking up a practice meditation. But if people are finding that content, and mostly in the past has been on Google or TikTok, a lot of content that isn't evidence-based, might not be high quality. So they're not getting good quality digital content for self-help. But then also, many are going to their primary care physician as a first stop. And the PCPs aren't addressed to help with behavioral health. So they're sending you to a specialist, they're prescribing a medication. But the reality is only about 25% of a given population actually needs therapy or medication or even wants therapy or medication. So how do we best set up the system to be more proactive, reach people with content and tools in the way that they want to be addressed, and help support that kind of matching process? And one of the things that we've seen is actually the good news is that self-help works. There's been a clinical trial that looked at the efficacy of Lexapro, a drug to treat anxiety, with a mindfulness practice. And in that clinical trial, both of those modalities or interventions had the same outcomes. So there's a tremendous amount of opportunity to meet people that are lower risk, that 75% of the population has a lower risk, with highly effective, low cost, scalable digital resources so that we can then free up the high cost clinical resources on the back end to treat that 25% that really needs and can value from that type of care. But what we're also seeing, as was mentioned, is that there's this tremendous impact that when you have a mental health concern in combination with a chronic or high cost condition, that the issue gets exacerbated and you really have much higher costs that you're dealing with. So when you have these comorbidities, we see 2 times the readmission rates. We see people utilizing the ER 4 times more and costing 5 times more. And a lot of that is because these patients are either not accepting their diagnosis, they're not being adherent to care plans because of the mental health stress that they're dealing with from anxiety, depression, or other mental health issues that prevents them from taking care of their physical health in the way that best. So we've created Credible Mind to address these needs. And we really focus our digital platform to help drive activation for members to take ownership of their behavioral health. We do that through multiple products. We have a self-care platform that has aggregated all of the digital content around behavioral health, scored it to make sure it's tied to evidence-based practices, and has gone through human review so that 75% can find digital self-care in a way that works for them and is high quality. We have a separate product called Smart Screen that helps to triage and find those rising risk members before they need clinical care and to intervene early and then navigate those members to clinical care when they need clinical care. And then a third product that we're building and launching with one of our health plan customers is around care advocacy. So this is helping members during a care management process as you're coordinating care and supporting transitions of care so that it's a wraparound service and helping to address the mental health needs of people across a care continuum or care journey. And through these products, we feel very fortunate that we're able to really help over 40 million people that have paid access to our solution right now. I'd like to give you a little bit of an example of kind of what our platform looks like. We're deployed as a digital platform that is a portal or a optimized web-based app. And as a user comes into our site, this is one of the user journey examples that we support. When someone comes onto our platform, again, we cover over 100 mental health topics, standard topics there like anxiety, stress, addiction and recovery. But over on the left, you see the various categories of content that we provide to help members. Things like emotional health or relationship health. So you're dealing with the mental health needs of a child or someone or a loved one, but also physical health. And this integration of mental and physical health is where we see a lot of opportunity because of that cost to the system and the challenge. So if someone comes into our site and starts typing in a search box at the top, which is how most people engage, start typing a word like diabetes, topic centers to the left, like living with diabetes, living with chronic illness, coping with the new diagnosis. So this is providing content to individuals to help them understand the condition that they're dealing with, but more so how to address the mental health aspects of that condition. To the right, various resources that are integrated from our customers. So these are the clinical resources that are provided by the plan or a hospital system. Credible Mind, we don't provide any of the clinical care. What we do is we provide digital resources to help with behavioral health, but then navigate to appropriate clinical care and do that in a seamless way through our platform that's highly customizable and configurable. And then if a user clicked on that Living with Diabetes Topic Center, they get a quick write-up on the condition that they're dealing with, but what you don't see is below there would be various digital resources around helping them understand and cope with their diagnosis, deal with the mental health issues that they might be dealing with, and that could be through taking an assessment to understand that they're dealing with anxiety or depression around this condition, and then providing resources and tools to help with that. And to the right, it's bringing in clinical resources from our client that also help address the clinical needs of that patient and that condition. So creating a holistic platform that addresses those various types of needs of members in a way that makes it easy for them to find what they need and addresses this comorbidity issue that we're talking about as well. Just a quick snapshot in terms of how we approach working with our partners and our clients. To the left, each user on our system has a profile. We want to make this process very data-driven so that we can personalize this approach. So we bring in plan design, benefits, eligibility information. We ask members how they want to be treated, their preferences around preferring virtual care versus in-person care, or their communication preferences. And as we learn more about those members, we're then able to drive this activation and engagement in our self-care platform in the middle. And as people are using those self-care tools and using our screening capabilities, it's then understanding if people are low to moderate risk, keeping them on a self-care platform, matching them to those types of resources if that's their preference around how to get care, and keeping those low-cost, low-acuity members engaged and active on the site with low-cost and scalable tools. But then as we screen with Smart Screen and identify rising risk members and triage them to clinical care, that's where we bring in our customers, in-network providers, so that those moderate and high-risk members can be treated from multiple modality standpoints, whether it's coaching, telehealth, in-person, whatever modalities our customers provide, but also looking at these various conditions. We focus on the behavioral health aspect of a member's need, but also if a member has these other chronic or high-cost conditions, we want to provide a wraparound service to help them through those care management processes. And although we don't provide any clinical capabilities on our side, we do have, again, we want to make sure we navigate to the in-network care of our customers, but also we do have a partner in an organization called NovaWell that provides clinical capabilities for those that might have challenges with access or other issues in their provider networks. And then again, I mentioned that care advocate solution. We're rolling that one out later this year, but it's supporting those care management processes from a care coordination, continuity of care, and care transitions so that we can provide ongoing assessment and monitoring of members. And then in the last piece, as users go through those processes, we want to be able to capture data around these processes and then generate insights and feed them back into our care management processes with the digital interventions we provide so that it's more personalized, but then also share that information with our customers so they can help a more personalized approach to care management. Just a couple of slides to talk about some of the results that we're seeing. And this is, I think, really important for us because a lot of what you'll hear in the market is people talking about engagement and engagement being thought of as the number of clicks on a website, how many times people are coming back to the website. But we really think about it more in the terms of what is the meaningful engagement that we're driving, and are people getting the value out of the solution that we're providing based on the way that we want to drive value, but also the way that our clients want to drive value. And as an example, when we see members on our site that are screening on our platform for low to moderate risk, over 80% of the time, they're opting to choose these self-care resources, so digital interventions that are high quality, rather than going to clinical care. And on the converse, when we see people screening moderate or high risk, they're over 30% more likely to then opt in to being navigated to clinical care in a highly personalized way. So for us, that really is a gold set of standard around self-care and driving self-care intervention, where we're helping people find the type of content, interventions, and resources that are meaningful to them, but then also helping to manage the cost and help provide care at the right place and the right time based on matching those members with the digital resources that work and the clinical resources for those that need clinical care. And over 50% of the users on our site that have used our clinical tools have taken up some type of proactive behavior change. That could be using an app to sleep better, understanding how to meditate, or taking up some other kind of daily practice like box breathing to manage anxiety or stress. So that early indication of behavior change and driving that type of outcome is really impactful and meaningful to us. And then we're also seeing over 90% would want to recommend this. Just a couple of other anecdotes around outcomes is we have a hospital system customer who was using a competitive product, and we were able to displace that competitive product And within the first 4 months of using our solution, we've been able to engage more users and more members than that other product did in over 2.5 years. So using this approach to being a digital hub, an ecosystem of self-care resources, integrating the clinical resources from the client, and making that navigation process easy, reducing stigma, allowing people to engage in the way that they want to engage and find resources and tools based on their preferences. We've seen some great results, and our clients are seeing that as well. And the same kind of result we're seeing on the health plan side, where one of our health plan customers had challenges with people going out of network for care for behavioral health services for many of those same reasons. And after implementing our solution, what we heard was in the first year of implementing our solution, they saw a double-digit increase of the use of in-network versus out-of-network care, which obviously really helps with maintaining continuity of care, understanding the data around the care and the quality of care by keeping that care in network. So just really pleased with these types of results and looking forward to working with more partners to help improve how we provide behavioral health services to the market at scale with this population-based approach that supports early intervention, engagement, triage, and navigation to clinical care. So I will turn it over to hear from our client, Jennifer Christian Herman at Blue Shield of California, and really appreciate Jennifer sharing some of their experience and their strategies around these capabilities.
Great. So thanks so much for having me, and I'm happy to share our experience working with Credible Mind. So first, a little bit about Blue Shield of California. We're a nonprofit plan. We have just over 6 million members across commercial, Medicaid, and Medicare lines of business. And I'm going to share just a little bit about our North Star. I think it ties in really nicely to our experience with Credible Mind. So our mission is to create a healthcare system worthy of our family and friends and sustainably affordable. And I think we would all say, when we think about navigating behavioral health care and resources, the current system is not really worthy of our family and friends. I think for probably most of us who've had some experience trying to navigate, it can be very difficult, and it can be hard to know what is a trusted resource, particularly around self-care. So if we look at our pillars of our North Star, the first and the last really tie in very nicely to our work with Credible Mind, and that is creating a personalized, high-quality experience and being digital first. I just thought I'd share that because I think it's a good framing for some of the work that we do together. So in terms of behavioral health is an enterprise priority for Blue Shield of California, as for many health plans, and we've really been focusing on creating an ecosystem of care, knowing that, as Clay shared, not everyone who is experiencing a mental health challenge or mental health symptoms needs clinical care. So we want to make sure it's very easy for individuals to find the clinical care they need that is high quality and meets their both clinical and personal preferences. But we know that's not enough. So we've also been focusing on how do we integrate behavioral health into primary care. There's some really well-validated evidence-based models, such as the collaborative care model, that show that primary care physicians can be a great front door for screening. They also can be the quarterback of treatment with behavioral health care managers and others to really provide care that is needed. There are also community models of mental health. There are upstream resources, which Credible Mind is our primary way that we're providing those trusted resources to our members. We're also focused on school-based mental health. The whole state of California is focused on that, and how do we ensure that youth are receiving care in settings that meet their needs, and then workforce mental health. So as we've been building out all the pillars of this ecosystem, having a single point, a hub where our members can go to understand what's available to them and to find resources in the upstream space, whether that's their front door to treatment, whether that's all they need, and those kind of upstream resources will serve as prevention for them, or as an adjunct to their clinical treatment. We know that those resources, content, et cetera, can be really valuable. And we also know if we build this ecosystem and we don't help with navigation, we're not really helping people, because that's putting an individual in the position of figuring out what is best for them. And that can be really challenging. This slide's pretty similar to the slide that Clay shared, although I think Clay's is a little more straightforward, but just showing that there's really a spectrum of behavioral health needs, and people don't just stay in one place in that. It is really fluid. And so as we focus on making sure for outpatient and more acute care, also making sure that we have those resources in the subclinical space, again, which can be an adjunct to treatment, but also can be an entry point for individuals who may be needing something but not sure what they need, or stigma may make people hesitant to seek the clinical care that they need. I think it was shared in some of the earlier slides, but we know that 1 in 5 individuals have a mental health challenge or mental health condition at any given time. So that means that all of us, I would say, dare to say, right now either know someone, love someone, or are someone who's struggling with a mental health condition. And so making that navigation and that front door to care and resources easy is one of our highest callings as a health plan. So we started partnering with Credible Mind in 2022. We actually learned about Credible Mind from one of our large employer customers who had implemented it for their whole workforce and shared it with us. And we were at the time really looking for a way to not only build out content in the upstream space, but also a landing page. We had a mental health landing page. It was pretty anemic. It was just, here's the link to our provider search tool. And we wanted to build out something more robust and engaging. And we felt that the content, the assessments, the tools, just even the how we incorporated the look and feel into our own branding, that it was just a much more welcoming place for our members as an entry point or a front door to our resources. You can see our branding, and I'd say Credible Mind was great in partnering with us on that. Our branding looks a little different than the site that Clay showed, and so we were able to accommodate that really easily, and it flows and fits really nicely with our website. What we found is that it has really increased satisfaction with our landing page. We have really high ratings of Credible Mind and the resources that are provided there in the same range that Clay had shared on earlier slides. But we also have seen a significant increase in our members' ratings of the ability to find care, because not only can they find trusted, curated content, resources, etc., but they're also really clear calls to action to the resources that we also contract with and provide, and to our directory search tool. So a one-stop place that people can come and find, if I want to learn about mindfulness, I want to sign up for a program that we might offer through our lifestyle medicine suite of programs, and or here's how I click on our Find a Doc tool to find the care that I need. So we've seen increasing year-over-year increase in use of the tool, and we are, as I said, significantly increased satisfaction with our landing page and the ability to find the care and resources that are needed. We find that some of the main areas that individuals are searching for and using the content, the things you would expect: depression, anxiety, parenting, aging, and finding treatment. I think I've said a lot of this, but some of the things for us, the ability to take assessments to understand what's going on with you, what might be most helpful, finding our resources, the content, of course, and ways to strengthen resilience. So what's next for us? I'd say it's probably what's ongoing, and much of this mirrors what Erin said in the beginning to kick us off. We are very focused on integrated behavioral health. So how do we, in the big picture, how do we integrate behavioral health everywhere that our members might be searching for it, but a particular focus on integrating behavioral health in primary care. We have about, as I said, 6 million members, and at this point, over 1 million of those members are receiving primary care in a medical group that is providing evidence-based integrated behavioral health. So we know that is an important front door and way to break down stigma and provide effective treatment. We are focusing on school-based mental health. California has a mandate called the Child and Youth Behavioral Health Initiative that puts schools in network, care in schools in network for all health plans. And that the definition of care is a little broader than the typical credentialed providers for health plans. So it includes school psychologists, community health workers, and will include peer support specialists. Value-based payment models are really important, but to get to value-based payment, you have to really get to how are you measuring outcomes, how are you measuring improvement. So that's an area of focus. And then health equity, that's always a focus for us. And I would say I'll weave parity in there, although it's not on the slide. As Erin kicked off with that, I think as health plans, we are all on an ongoing mission around how do we truly achieve parity and demonstrate that. And now we're going to move to some questions and answers. I think my fellow speakers are going to join me here.
Thank you. At this time, we are going to address some questions that came in during the presentation. The first question: the integration of behavioral health and physical health is a compelling proposition. Can the panelists share more about how you are thinking about and doing that?
Maybe I'll start with that. I already said a little bit, and I realized I said over 1 million of our members. It's actually 2 million of our members, so I was underselling our work. But yeah, I think that integrating behavioral health first of all, it takes change management. They're great evidence-based models. They've been around for decades. There are hundreds of peer-reviewed studies. And yet we haven't really, as a country, I'd say, really been able to take it to scale. And because it's learning a new muscle and how you integrate that and do change management within a clinical practice. But when you think about the quintuple aim, it really addresses all of those things. There's strong evidence of improved outcomes, it improves member experience, it improves provider experience, clinician experience. It's hard to screen for something if you don't have an easy path to address it if you get a yes. And so by having these evidence-based models, it really empowers primary care and other clinicians to help their patients with mental health challenges. It also decreases stigma and it improves equity. There's shortages of mental health clinicians and care in many parts of the country. There's shortages of primary care too, but I think if you have a primary care doc and that person is well positioned to help support you in your mental health, then that really helps with equity as well. So I'm clearly a champion of integrated behavioral health.
There's also the perspective of just integrating with the workflows and screening. So we're seeing an increased number of integrated models and payers working with providers of screening for mental health. The PHQ-9, I thought it was interesting that recently I had to see a neurologist for a condition and they gave me a PHQ-9 at the neurologist's office. And my doctor's office does it too. So there's increased screening, but there's even additional screening. As I mentioned earlier, with new technologies, with voice biomarkers, are able to detect depression and anxiety. So I think even with the new requirements that have come out just recently around screening members for mental health, it's getting more involved in that traditional physical health kind of office visit so that we can understand who needs that support and how we can get them to the right navigation point to find the care that they need.
Yeah, Deb, I agree with all of the points from my fellow panelists. And at Credible Mind, we've been putting some focus on this over the last 4 months specifically, doing a lot of extensive market research with our existing clients, but also with others out in the market to really better understand what are the primary problems and challenges that organizations are trying to address when it comes to integrating behavioral health and physical health, and what is a practical starting point? How do you do this? It's a big undertaking, something that isn't going to happen overnight. There's been a lot of efforts to try to do this in different ways, but one of the things that we're seeing is just the barriers around data sharing, and we're trying to put in practices to really help reduce some of those data sharing barriers, because at the end of the day, to really integrate care across these two different somewhat silo practices in a lot of organizations, you need to understand the totality of a member. What is that whole member experience and what is that whole person dealing with? And so with us being able to bring in new data from self-care, and as Erin is mentioning screening, we're able to regularly screen users on our platform, have more real-time kind of insights into a member based on that, tie some of that data to clinical care. And when you're trying to integrate these models, so I think for us, a lot of it is helping to address that data sharing barrier by collecting more data, implementing kind of scalable screening tools, providing a more holistic picture around a member with the integration of this data, but then also finding ways to start. And so we've been working with some of our more proactive customers to understand their strategies around the integration of these two clinical services, and how do we target kind of some smaller specific populations where we know a small percentage of the population drives a high amount of the cost. How do we target some of those populations? How do we build a service that wraps around them to drive the quality of care outcomes that we want, the cost of care outcomes that we want, but more so, how do we improve quality of life for those members through these processes? So we're working on some opportunities to test out and prove out some of these concepts over the next year or so.
There is some behavioral evidence that people are more honest with more machine-like bots versus humans or human-like avatars in these types of screenings. Any thoughts to leverage those types of approaches?
Interesting. So I'll pick up there again just real quickly because that's an area that we've been doing a fair amount of work and seeing some things where I do think what we're seeing and what some of the literature is showing out there is that a lot of the challenges with people signing up for behavioral health care and raising their hand is the stigma issue and why a lot of people start with self-care versus wanting to go straight to a clinician because it's a sensitive topic, especially if you're an employee in a workforce, a caregiver that's providing care to patients. You don't want as part of your record that you've seen behavioral health services because it could impact potentially your job. And we actually have a couple of provider systems that are using our solution to manage the mental health and behavioral health needs of their doctors, clinicians, and nurses who are dealing with compassion fatigue and burnout. But they can do it in a way on our platform that is anonymous and can help them in their processes. And because of that, the way that we deliver that content, the reduction with stigma and using a digital tool versus talking to a real person, we do see people share more. You can capture more data when people intervene with digital tools so you can have a better picture of that person and support more personalized care because you have a better understanding of what's driving those needs, what's really driving the underlying kind of challenges that people are dealing with. So it's something that we are continuing to explore and see how we capture more of that data, even things like journaling, where we can apply natural language processing and new technologies like that to understand how people talk about behavioral health. Different people talk about behavioral health in different ways and use different terminology. We have more of a clinical taxonomy around it, but people don't use the clinical taxonomy when they're talking about their mental health challenges. So how do we better understand how people are talking about and thinking about their mental health as they engage with these digital tools and use that to personalize how we treat them from a care management and clinical standpoint?
Also, the evolution of these digital tools, because we've also seen those studies. We recently worked with a solution that was using an AI chatbot to coaching for diet. And what they found is that people are much more honest. And when you walk into your trainer or someone you're reporting to about your goals, you sometimes fudge the results a little bit, but you are more honest when you're actually talking to an AI tool. So that's why the other thing too is we did a survey a couple of years ago when AI really started to come onto the healthcare space. And initially, a lot of payers were very reluctant, but over the course of the past 2 years and follow-up conversations with payers, they've all told us that they are going to embrace AI because they know that they just can't solve it from a provider and tool perspective. So there is a lot of growing interest in how AI can change that moving forward and provide more access and more care for our members.
Yeah, I was just going to point out also, I think there's definitely the stigma reduction and the sort of perceived anonymity a bit of it, but also just the convenience of it. I think if it's whether it's a care manager, your clinician, but it's a more of a human interaction, you're on the spot in that moment. You may not connect with that person, or you may not have thought through what your answer is. But I think that there's also with different digital assessment tools, you can respond when it works for you, and you may have more time to process and think about what your response is. So I've seen definitely some of the literature around, particularly in youth, but also in populations such as birthing people postpartum, dealing with postpartum depression symptoms. It may not be convenient to talk to that person who's going to assess your symptoms, but if you get a text prompt and you can respond in that way, it may make you more likely to respond and to respond honestly.
What are healthcare plans and insurers doing to bake mental health care into medical benefit contracts for patients and PCPs? Observes. We don't carve out healthcare.
Yeah, okay. I'll start, and then Erin, you may have some good thoughts on this, but I think that partly it's the parity answer, right? It's how we structure benefits and parity, and certainly the more recent parity rules are more prescriptive in that.
Yeah, I think it's back to that concept of parity and making sure that the benefits are aligned. Back in 2009, we first started looking at this, we were all challenged, but moving forward, it's become a mainstay to make sure that your benefits are aligned from a physical health and mental health perspective. From the perspective of contracting, I don't know if that question is related to contracting with providers. I think that contracting is done in similar ways. Obviously, we mentioned earlier that the reimbursement rate for mental health providers is traditionally been lower than physical providers, and that's all presenting a challenge. So as you're increasing benefits for a solution, but you also don't have a direct line of increasing the provider network, that's what creates the challenge of what we're talking about today, because there have to be other solutions outside of just face-to-face interactions with therapists.
Yeah, I'll just say we have focused now for a number of years as we've built our network significantly around the value proposition to mental health clinicians to be part of a health plan. I'm a clinical psychologist. I know many of my peers who do not. In part, it's around reimbursement. It's also around administrative burden. And so how do we make it straightforward for clinicians to see the value in being part of a health plan, because that's often a challenge. And as you said, I think it's around offering the whole array of treatment options to meet members' needs, but also to ensure that there's access. And I think that's where the integrated behavioral health and other kinds of resources both make it easier for people to find what they need, but also to really expand access.
And we're hearing from payers too that they're leveraging more coaching options. When this parity first started, it was more around psychiatrists and psychologists. But the evolution is now over the last 10 years that coaching does have a significant impact, which I think was what drove CMS to start covering it starting this year. So from an integration perspective and a scope perspective and access, we think that coaching is going to be a good option for many people.
How does Credible Mind or the payer know what member is getting care if there is a focus on anonymity? How is performance being measured other than clicks through content?
Yeah, that's a good question. For us, where engagement and activation works best is where we implement single sign-on and we have people that are logged into the site, and we can drive more of that personalized approach. And that is the approach that we typically take with our health plan customers. But there are specific use cases where there is a need for a more anonymous use. And we do provide that flexibility for anonymous use, but typically it's for unique use cases and purposes for populations that need it. As I mentioned, the kind of risk around clinicians and using these types of tools around how to manage their care management processes. But our standard model is working with our health plan customers to understand their current capabilities to engage with members, doing single sign-on and helping to provide an engagement playbook that we provide, and helping to create content, help with an editorial calendar to make sure we understand messaging that our customer wants to address over periods of time, and then supporting them in that outreach process to members. And when they come to our site, and most often is someone logging into our site, and as part of their profile, we're able to capture that information and drive that personalized approach. It is just building out the model that best meets the need of the client and the use cases that you're trying to support.
And as a plan, we look at I'm sorry, I was going to say, as a plan, we look at utilization across all of our utilization of Credible Mind, our utilization of our other products and our network. And we survey our members and we ask them, so it's not a perfect measure, but asking them about both their satisfaction and their ease of navigating and connecting with the resources they need with clinical care. And so we use that as a barometer of our members getting what they need, even if we can't always identify exactly which member is using some of the self-care resources.
And many of the payers that we work with, they look at this in 3 different buckets. The first bucket is exactly what Dr. Jennifer mentioned, is just the self-assessment, the surveys, the screenings, what members report back to the payers about their access and their care around mental health. The second category is that it's the click-throughs, it's the access, but we never want to downplay. If you get someone into a navigation tool, that is a huge feat. And as Clay mentioned earlier, they've been able to do that at a significantly higher level. So that's an important measure. But the third tier, which is obviously the most difficult one, is actually looking at how these things, looking at claims data as well, impact overall spend. So actuaries can look at this and look at over the course of a 2-year period, people that are getting their mental health claims that have a chronic condition, that have aligned risk scores. to see the impact of being engaged in a mental health solution, what that does over a period of time to their medical claims. And there's been multiple studies that show that it does have that direct correlation and an improvement on trend.
Yeah, one thing I'll just add is I didn't really address this question around engagement or quality as it comes to people getting access to what they need. One of the things that we're seeing is there is a movement towards better measuring value. I would say value. How are people engaging with behavioral health? How are they using behavioral health care services? What is the quality that comes out of that? And at least from a quality standpoint, the market is more framed on now measures that are being tied to HEDIS and STARS now to support quality measurement. But those are lagging measures, but it's the place that people best know and it's where they start. But NCQA, URAC, and others are starting to promote a more proactive model around this. And this is where Credible Mind, being more on the front end of a care journey, we're focused on being more proactive around our services and providing more leading measures around quality. And when you think about that, there's this measurement-informed care process that's being adopted and championed by NCQA, and URAC. And with that model, it's more around what we've been talking about. How do you assess members early? How do you understand what their needs are and support data capture early in a process around engagement, continuous monitoring so that you can support a patient and provider collaboration process. And even NCQA has recommended some initial measures around this. So helping to identify what a patient's goals are when they're being treated for behavioral health, and then following up on those goals. And then are you helping that member achieve those goals in a 6-month time frame? So that's a lot earlier in the funnel than waiting for a claim, than waiting for some follow-on lagging measures. On our platform, we're powering that type of data collection with our screening, with our digital interventions, so that we can provide more leading measures around engagement and quality versus the lagging measures, but also supporting the lagging measures as well.
What is your top goal or goals for behavioral health care improvement?
I'll go first.
Yeah, good.
Yeah, from our discussions with payers, a few goals that, aside from the obvious ones, which is expanding care and getting more people engaged in digital solutions, is providing more solutions like we're talking about today. Self-care solutions where they can identify and self-treat is a top priority. Expanding coaching is a top priority. Another interesting one too, and Dr. Jennifer mentioned this as well, we were actually retained by a large payer to find a solution, a virtual solution for adolescents and children. And no surprise there, after we talked to over 50 digital solutions around childcare, we only found one that could actually do that virtual care down to the age of 13. Finding care for adolescents and children is definitely top of mind for payers as well.
I would say, just going back to our top goal around behavioral health, is I always go back to the quintuple aim, which everyone is familiar with, but we want to make sure that members get access to the care that they need. And that is having right clinical outcomes, our members' experience, our physicians' experience, our clinicians' experience. Can we get behavioral health clinicians in our network? Did they stay? And the equity, as I mentioned. And then also, let's not ignore cost of healthcare. We know that by providing the behavioral health care and making sure that members have access to the care that they need, then that's ultimately going to result in a lower total cost of healthcare. So our primary focus is on quality and access, but we know by doing that, that's going to make the healthcare system more affordable for everyone. And so that access and quality are always our top priorities.
Yeah, I think I echo a lot of what Jennifer is saying. It highly aligns to a lot of the goals at Credible Mind, which is supporting that triple aim. But from our angle, I think it's a lot more, how do we support a population-based approach to behavioral health so that the 75% that are low acuity, low cost get access to the high quality digital interventions that work best for them and that they prefer, and then helping to streamline and navigate that process for people that need clinical care into clinical care, and doing that in a kind of whole person and holistic approach. A lot of our focus, as I mentioned, is working with our clients to knock down those data sharing barriers and understand how can we help people that are struggling the most with these challenging chronic and other conditions, but also the mental health aspects they're dealing with as well. Just being more proactive, more population health view around how we help our customers. And to Jennifer's point, meeting people where they are and matching care to the type, matching capabilities to the type of care that people need.
Any final comments?
Just from my side, I really appreciate our panelists being on here with us and everyone joining us today, and just the great insights that Jennifer, you're sharing from your experience at Blue Shield of California, and specifically some of the experience at Credible Mind, and Aaron, the great work that you guys are doing to help address the various sets of needs of health plans in the market and the types of insights that you guys are being able to provide. So just really appreciate the time and the focus on this topic. It's an important topic when there's a lot of opportunity. Appreciate the innovation that's going into it.
Thank you to our speakers for the great presentation and for sharing your thoughts. Thank you to the audience for participating in today's webinar. This concludes today's presentation, and enjoy the rest of your day.